Fantastic. And I'm Adrienne Hampton. I use she, her pronouns. And I am Kitsap Public Health District's Policy Planning and Innovation Analyst. So I live kind of on the borderline of Bremerton and CK. I'm just kind of right across from the Fred Meyer above Jennifer Chamberlain's district. So I'm technically in unincorporated Kitsap County, but I'm still on Bremerton sewer. So I like to say I still involve myself in the business of the city of Bremerton. But I love living here. I've lived here since 2019. My husband's family has been here for 25 years. And so that after graduating from grad school, I moved over here. My former career is actually in biodiversity conservation sciences. And I merged that with my master's degree in public policy and governance from the University of Washington, the Daniel J. Evans School of Public Policy and Governance. So I kind of formalized that into more of a environmental justice, climate justice kind of policy background. And in that work, before coming into public health, I did a lot around health equity, specifically in South Seattle around the Duwamish River cleanup, the Superfund cleanup, and the kind of, trying to mitigate the health impacts that come alongside living in close proximity to a Superfund site. And so I did that work for many, many years. And 6 months ago, I decided to make the transition. I really wanted to work locally where I lived. The commute is so much nicer. And so it's really wonderful to apply that unique set of skills in our own community. And I feel very lucky to be working at the public health district. So my position was newly created before my program came about. Policy activities were happening within and throughout our various programs. And we also did a lot working at the state level with they call it the SALFO. So they're kind of our advocacy arm, because we ourselves can't lobby, but they are our advocacy arm. And so we work in tandem with that organization to do additional activities at the state level. My background is in public administration. And so I don't have an NPH, but I work with a lot of people who have an NPH, and I've really quickly been immersed into this field of public health, which is near and dear to my heart. And it's just so important for our community. And I will, throughout the presentation, I'll share a little bit more of what that looks like, and then kind of the things that I've been involved in for the past 6 months. This is my first in-person community presentation. I got the green light. They said, go for it. So I was so excited. So I will always remember that this league would be my first community presentation, and it feels actually quite appropriate. So thank you again so much for having me. And also for your I would say like commitment or interest in and around things related to people experiencing homelessness in our community. I joined Public Health District in May, and starting around July, this is something that I've picked up. Public health traditionally has not had like an established program around, specifically dedicated to providing I would like direct services for folks experiencing housing instability. It was, traditionally seen as that's something that human services, does, within Kitsap County. But especially more recently, we've been having closer conversations around what would it look like for public health to pick up, or I like to say, have a slice of this pie, and then we can all continue to bolster our collaboration and coordinated I would say like expertise in this area to ultimately not just help move folks into safe shelter spaces and safe sites, but also to ultimately help them move through and exit homelessness and increase their well-being, social connectedness, and all that kind of thing. So it's very much something that's on my plate. That's the kind of innovation part. And so with this increased capacity, where there might be an issue that comes up in public health where it might not have like a programmatic home, that's something that comes on my plate, and hence the policy development, right? So we are very much committed to navigating, exploring the ways in which public health can be a partner in some of these ways, even if it's not, tied directly to one of our programs. Like like family child health or disaster preparedness or our epidemiologist work. And even just by saying that, and something that I've been a lot of the conversations that we've had internally is around, well, so many issues in our community touch public health in so many various ways, and we can look at that as they call it like an emergent strategy, right? So even if we don't have an established program, what does it look like to gather all the pieces together, right, to form a strategy and help us navigate through to ultimately do our part in helping reach those goals. So I hope that makes a little bit of sense. Any questions for me before I jump in?
This position was newly created.
Yep.
For you.
I was hired, yes.
Okay. So the health district had been contemplating a role.
Yes.
A more active role.
A more active kind of formalized role. Yeah.
Okay.
Especially for things that might fall out of one of our like programmatic homes. And I'll explain a little bit more about that. So that's all to say that I always have my ear to the ground. I think that people, are always saying, oh, is that the public health? Is that a public health thing? And that's all just to say that feel free to reach out to me anytime if you see like an emerging issue or something coming up in the community, and that is something that we can explore and help connect you to who is, actively in that work. Okay. Any other questions? Let's dive in. So I titled this presentation, Public Health Approaches to Addressing Homelessness. And I have a lot of information and data to share. We often start out that like macro big picture type view and then kind of work our way down the social ecological model. And we'll run through a little bit of that as well. And let's see, where should I start? I'll start here. So I have a couple of acknowledgements. Okay, good. Space bar is not showing. Okay, great. So a couple of acknowledgements. In talking about homelessness, I think it is so important to acknowledge the importance of social connection and social connectedness. We know, and it's been well researched, that isolation and a lack of social integration are as harmful as smoking, according to national and international data. And that's like, when you sit with that, you're like, wow, that is really serious. And so I pull that out just to say that social connectedness is a major theme throughout this presentation and throughout this topic area. Our U.S. Surgeon General recently released a national framework to address loneliness and isolation as a national crisis. This, I think, was, definitely exacerbated during the pandemic. And as we all kind of, try to reconnect, if you will, emerging from the hardships of the pandemic, it's something that we can call more attention to. And so this is all to say that there is kind of a blueprint for what does it look like to increase social connectedness, because we know that it impacts our physical health, it impacts our mental health, and it can also lead to other, substance use disorders and these kind of things. Here I have, how does that look on the screen? Okay, it's a little small, but social connectedness, again, as a theme, is something that is really important when we're talking about experiences related to feeling overwhelmed or trauma. And so I think that in any type of social situation, it could be that, it was a large medical bill, or maybe someone lost their job, or, something happened to a family member, or even growing up, a set of experiences contribute to feelings of being overwhelmed or, incidences of trauma. And we know that as human beings, that those type of experiences lead to various type of triggers within us, right? So that could look like, feeling disheartened. It could look like kind of feeling like, what is my purpose? It could lead to things in our nervous system, lead to mental unwellness or other behavioral type issues, anger, loneliness, so I think those are natural responses to experiences related to trauma, or just like chronic stress and feeling overwhelmed. And so in this conversation, that's all to say that we are all human beings who have our own unique set of experiences. We have to keep that at the heart and core of this conversation. And this is so important to remember because it also helps us undo stigma. The human brain, it tends to, oops, I'm ahead of myself. The human brain, I think, for complex issues, it's so natural for, I'm going to speak generally, but to, for us to put things in categories, right? To try to break up the issue and try to really understand. But often when we do that too quickly, or we do that and we're not well informed, it can lead to stigma and bias, right? And so it's so important that we take steps to truly understand, lead with trying to understand, or I'm saying understand a lot, but right, trying to understand the set and circumstances that that person might have gone through before we, try to help someone find housing or access treatment or that kind of thing. So again, social connectedness is so important. I know there are the handful of outreach teams that have been working and are so dedicated to supporting folks living along MLK and Broadway and Silverdale, Hospital Hill, Clear Creek area and more. Those outreach teams center outreach, center relationship building. And it might be, 4 conversations, 5 conversations, 6 conversations until you're talking about how can I help you? Where can I connect you? Those relationships are so important because then we can really understand the individual and then get them to services or help them truly access their needs. And by doing that, again, we can undo stigma. And so we want to do that because stigma can lead to a person's or can limit a person's ability to access services, or they might not, maybe someone assumes something of them when they enter the door, and that could create a feeling of not feeling like they belong there or they're unwelcome, and therefore they might not want to go access those services just because how they were treated. And so therefore it kind of creates a barrier. So we can ask ourselves as a community, how can we decrease those barriers so folks feel more maybe willing to engage with those services and more trusting. And so I have a little visual to kind of show we want the full lush tree, right? Not the bare tree. And ways that we can approach, or I would say strategies to undo stigma include things like when we're having a conversation like we are now of what would a shelter site look like, right? Do we want tiny homes? Do we want a congregate shelter? What type of kind of facility or infrastructure do we want to have? Let's involve those folks who, will be living there, right? Let's reach out to them. Let's involve them in the development and planning process. That's a really good way to undo stigma and also increase social connectedness. We can involve folks in decision-making or other type of engagement activities, just so that in the community at large, so everyone's feeling like, they've been consulted and that their feedback and opinion has gone into this process. Because ultimately we have to think about who's most impacted and who are we really talking about and who's this for. So making sure that we are doing that social connectedness. And then let's see. Oh, I would also say using person first language is so important. So for example, homelessness does not define an individual, right? Drug use that might have resulted from a family trauma does not define the whole person. And so that's why you hear language around like people experiencing homelessness or someone who is involved in risky behaviors or that kind of thing, because it kind of separates that person from the experience, and it just says that experience is not that whole person. And I think that is also really helpful to understand. Okay, so for the let me stop there. Any questions on my acknowledgement section? Social connectedness, undoing stigma, approaching the individual. Kathleen, go ahead.
So I think you're silenced.
Yes. Sorry. I'm guessing that you have a connection with Kitsap Mental Health.
Yes, absolutely.
And for the languages, do you have a source for translation? If there's an immigrant or someone that's not in the system yet?
Yes, so I hear what you're saying. So it could be, and it depends where we are and who we're talking about. So say if there's an interaction and say if there's like a one-on-one interaction and that person feels they're not bilingual or can speak that language. I think there's always a tool or a phone call to find someone who can do that work. I think that teams like the Heart team, the Rock the Block team, the Real team, these community or county and community organizations that have been working one-on-one and directly with folks have those type of services integrated and would know who to call. I think we're seeing a lot of case managers or direct service providers. They know the importance of providing translation in these kind of things in situations. And then I think, once someone gets to a shelter space or the hospital, making sure that those facilities also have those resources. So I do know that is something that is very, very much taken into consideration. And there is a processes to make sure that access is available. But great question. Any other questions? Okay, let's keep going. So that's all just to say that by forming more positive connections and inspiring a sense of hope, that is so helpful, right? To someone who might feel as though, okay, I'm willing and able, and I want to take this big step and improve my circumstances, however that person might decide that for themselves. Oops. Okay, so in this presentation, we'll go into a little bit of Kitsap Public Health, our mission, our role in the community, kind of what we do as a public health district. And you'll hear me say district. So we're very much unique, a little bit different from King County, Seattle Public Health, in that sometimes you see local health departments that are like integrated in the whole kind of county system. Kitsap Public Health District, we're our own actual district. So that's just to say, like, jurisdictionally and kind of how we operate, it would be considered separate from Kitsap County, but best believe that we all talk to each other all the time, and there is that connection and interagency collaboration. I'll go through data and trends and contributing factors. That is I know super helpful to me to understand. And then I'll talk a little bit about strategies for supporting our unhoused community members, as well as those ongoing developments. So as our policy analyst, I'll try to share out with you as much as I know, and maybe you all know a few other pieces too. So Kitsap Public Health District, our vision is a safe and healthy Kitsap County for all. That is the goal, that is the mission. How we get there is we work to prevent disease and protect and promote the health of all people in Kitsap County. We have our guiding principles that includes prevention work, collaboration, quality, equity, and innovation. One of my favorite words. And someone recently asked me, because they heard me say public health approach. What is a public health approach? So a public health approach is one which identifies and defines the problem. We prioritize prevention and upstream evidence-based intervention. So that's all to say, when we think of this, river of life, sometimes downstream, we're like, why are we dealing with this? We have to look upstream to find that source, similar to like a pollution spill, right? If we see that we have a problem down here, let's go look upstream for the source of why that's actually happening. Some people refer that as like the root cause. That's really what we're interested in doing, that nitty-gritty kind of systemic change work that's going to ultimately increase the well-being for the larger population. And to do that, we can use data and evidence to identify solutions and elevate the success of their implementation. And we can't do that without collaboration, community engagement, conversations like these, all things that are concerned with protecting the health of our entire populations, and that includes subpopulations. I love this color wheel. We are so lucky that in Washington State, our legislature funds public health. What that looks like. So we, our state refers to it as foundational public health services, and or like FPHS. And that was designed so that all local health jurisdictions in the state are essentially providing these same set of services. And so our programs at the health district reflect those foundational public health services. And then we try to, again, have that emergent strategy to tend to other things that might be happening in our community to keep that place-based kind of, local approach to things. So we have many programs in the health department, and they all kind of encompass these essential services that public health is ultimately responsible for. And I think all those things can be summed up in policy development, assurance, and assessment. So we assess and monitor public health. You have that data in a fact sheet in front of you. In the kind of policy world, we can use legal and regulatory actions. We can communicate and inform and educate, and we can create and champion policies, right, that will benefit public health and the health of our community. We also look to things like equitable access to services. Don't worry, I have a lot of healthcare slides in this presentation. And we also think about what does it look like to build a skilled workforce, especially as we emerge from the pandemic, and workforce is definitely something that we have an eye on. So if you have any questions around what is the work of public health and these kind of things,
So
let
the
me
word
know.
workforce, we talking about the public health department, or are we talking about in this general state population?
I would say, looking through a public health lens, it would definitely be, yes, the public health departments. So making sure that we are well staffed and resourced to carry out our own mandates. But in addition, where can we recognize opportunities for creating pathways or opportunities for young people to be involved in not just public health services, but the things that are deeply attached to that, like healthcare services in our community. That would be a good external example, I think. Yeah. And equity is at the heart of everything that we do. My favorite is create, champion, and implement policy, plans, and laws. That's just my own, shtick. And we can apply all of those essential functions to our social ecological model. So this is a neat way to kind of look at, okay, good. I'm looking at this screen and this screen and this one, because the words aren't clocked. And so we can apply that skill set to our social ecological model. So if we kind of look at, okay, Kitsap County, right? We have the individuals, like all of us and our individual experiences here in this room. Then we have the organizational. There are amazing people doing amazing work in this community. Kitsap Community Resources. I mentioned the real teams, specific to this issue. We have our community organizers. So these are both in like people who organize, coalitions, just like you all, who might be paid or unpaid, who help grow community capacity and capabilities to influence resiliency. Then we look at the community wide. So this is like what infrastructure we have in our community, what is our cultures in our community, right? How we go about doing things. It could look like our networks that influence social determinants of health and these kind of things, so that community-wide picture. And then we have the big kind of systems bubble. So that would be like our national, state, local laws that shape health outcomes in our state and our community. So what is so important about the social ecological model is that it shows us how we need all of these things working in tandem together. And when one part of this kind of holistic model might be lacking or might be missing a piece, we know that it's going to impact the other pieces of our ecosystem, if you will. It's kind of the similar way, this is my former environment brain saying that, when you have like a keystone species like a salmon, right, on decline, it impacts our whole ecosystem, right? It impacts us all. So what can we do, right, to improve and reduce those barriers? And we can apply that same kind of concept here. Yeah, go ahead.
You mentioned, and I'm familiar a little bit with our team and the real team,
The real
and
team.
then the rock block team.
The rock the block
So
team.
can you explain just quickly?
Yeah.
Real team and rock the block.
Oh, yeah, thank you so much for pointing that out. So throughout this presentation, I'll just be like weaving in the kind of like what's happening locally in regards to homelessness and kind of referring them back into here. So currently the like on the ground people who are providing that, consistent kind of, when I was talking about social connectedness, outreach, intensive services, helping with referrals, case management, the entities or like the organizations that are supporting that work are the HEART team. So that is within Kitsap County Human Services Division. That team was created, I believe, in response to the Veterans Park encampment back a couple years ago, and is working county-wide. So they have a lot of involvement in Silverdale, and then more recently have been supporting efforts here in Bremerton. The REAL team also does case management work for individuals, and the Rock the Block team has been really focused in Bremerton. That's a group of community organizers who have successfully helped rehome 30 individuals, might be more now, to find housing and other services, and they're doing their work unpaid. And so that's all just to say that there's a lot of teams on the ground providing that immediate direct service at the individual level.
And the REAL team is a paid?
Yes.
Are there county?
The REAL team is a nonprofit organization. They are compensated for their work, and they are associated with the Agape group.
Okay.
Yeah,
Thank you.
you're welcome. Thanks for the question. And if I do that again, just please let me know. It's sometimes hard because you don't know who knows all the pieces.
So on that REAL team, is that like that when you hear about, and I saw it in the paper, somebody was hired as a navigator person?
Yeah, like
Is that the REAL team, or is that?
So there are
just another group of people?
there are navigators within the REAL team, yes. And then I think most people who are like literally helping someone navigate where they need to go or what services they want to get connected with. Sometimes that's called like a peer navigator. It could be someone who has previous experiences related to that individual they're working to help. And that's another really good point of how that representation in the services are so important. Is that helpful? Great. So, yeah, the social ecological model. And let's see, I would say, so let's kind of give some examples here. So when we think about the social ecological model, and we can apply that to the topic of homelessness in our county, we think systems, right? What are like the various laws and kind of things that are that may shape health outcomes or may have some kind of influence on this issue? And so an example there at the systems level was the recently passed City of Bremerton's unauthorized camping ordinance. So that's a really good example. And I think that's a catalyst that led to a lot of community engagement around this, around homelessness in our community. And so that kind of emerged most recently in January and has been a kind of an ongoing conversation. The community level, so these are things like the infrastructure, our culture, the networks that might influence. On the infrastructure piece, I'll just point out shelter availability. We have very, very limited shelter availability in our community and across the county. There are incredible efforts underway to stand up shelter space. So that could look like the Mile High shelter space that will be opening this upcoming spring in Port Orchard. We know that Mayor Wheeler and the Bremerton administration have been hard at work planning shelter space in the city of Bremerton, and which most recently, I believe the location site is up Kitsap Way across from Oyster Bay Inn behind the Chevron. I don't have the exact address, but it's in that area. And we recently, you might have read in the Kitsap Sun, efforts to have what is like, a daytime center where someone could go in visions for these things. And then we can connect that right to the systems level of how do we make that happen? And we know that funding is a big part of this conversation. At the organizational level, I named a few community organizations who are hard at work in this regard. And so, what does it look like to increase the capacity of those organizations to be well-resourced to do that direct service? So then we can right? Make those personal connections with the individual, because ultimately that's what that's about. So do you kind of see how this social ecological model kind of all functions? Yep. And so that's the way I'm constantly looking at this issue. And so it's so great to have kind of people hard at work, at the individual, the organizational, the community, and the systems, because we need it, right? We need it to all work together in tandem. And I do think that there is still opportunity to grow that collaboration. So that's the framing. And then ultimately, if we do that really, really well, we can increase community resilience. And it could look like this, right? We could have we can bolster healthy and supported individuals and families, safe and stable neighborhoods, environments that promote social connectedness. And then under the tree, right? Trees have roots, right? And these are the things that tend to be like really, really hard, but things like affordable housing, restorative justice, community-driven policy, living wages, and integrated social services, just to name a few. So this is like the tree of community resiliency. And I think this is like the model that we're working towards, and making sure we have strong things happening across all these areas. Did I want to say anything on this slide? Let me check my notes. I think it's fairly self-explanatory. So any questions on the kind of social ecological model, or, the kind of bigger picture framing? No? Helpful?
So it's important for the community to know. So I know you are doing these open houses, trying to get the community informed.
Oh, right, with the data summit.
Yeah,
Yep.
so, but it seems like people don't know. So are there conversations about other ways to, make it more, because what I'm hearing is really wonderful, but I don't know that the community knows how hard everybody's working.
That's true.
So-
That is true. Yeah. And I think that is, you can never over communicate. And I think that is just like it's almost like an infinite measure, right? And so I think every day we're thinking creatively of how to reach people. I will give an example at the public health district. Some of you may receive our kind of bulletin or, advisory or like health alerts. Those now go out in English and Spanish, for example. We think about, again, like with the data open houses, how can we not just be in one place, have things just be in Bremerton, but do like multiple location type efforts. And then how can we also help to promote other agencies to also do that same type of engagement and outreach support. So for example, related to homelessness, come November 1, the Salvation Army Emergency Shelter will be open. And so what we could ask ourselves, what is the plan to communicate that, right, to folks who are unsheltered, living in our community, and help them know that space will be available. And then what can then we put in place to make sure that they have transportation to get there, right? There's going to be someone kind of on the ground who can help connect them to that service. Or maybe even someone makes a call to a police officer, right? What is the directive for Bremerton Police Department when they are acting or in a situation where they are corresponding with an individual, and making sure that they can call in someone, right, that can help that person get to where they go. So it's very much like, how can we work really close together to help spread that word? And I have a slide towards the end of this presentation. So for folks who might not be experiencing housing instability or need to go to a shelter, but you're just a community member who really cares about this issue. Again, social connectedness and civic engagement. So I recently learned from the most recent Bremerton City Council meeting that the mayor and Bremerton administration will be giving regular informational updates in regards to the shelter space development and other efforts during the city council's study session meetings. And so those are things that get posted on our BCAT. I think they go on YouTube and you can watch those. And so those kind of regular informational activities. And I'll also say there's always the opportunity, as you all know, to reach out to your electeds. I know Mayor Wheeler, specifically speaking for Bremerton, is really good, a strong communicator, you can always email him, and he's always up to give you an update, or will CC someone to help get you that information.
So the Kitsap Mental Health Campus, there's all kinds of construction north of that. Is that related to Kitsap Mental Health, or is it like a halfway house? Or, I mean, there's a lot of units going in
That's
right
a good
next
question.
door.
I don't know off the top of my head. I think that
Okay.
would be a really good question for them. But I think we're seeing a lot of construction coming to our area, and a lot of new units going up. And sometimes there's a lot of projects happening, and so I'm not exactly sure about that one. Yeah, go ahead. Do you know?
No, I don't. I was just gonna ask, finish your sentence.
Oh yeah, no, go ahead. Go ahead.
I'm curious, what is our shelter capacity versus the number of people in need?
That's a good question. So, this is information that the HEART team collects. Kitsap County HEART team collects. I believe the last time I spoke with their coordinator, the list is over 200 individuals who would be, who they have made contact with, and who would be looking for shelter space. To access a shelter, you have to go through a coordinated entry process. And so there's kind of a set of criteria and things that one would need to go through then in order to access the site. And so sometimes I think there's a notion of the shelter's open, just walk in, and that's not necessarily the case. And that's all the more reason why you will continue to hear that shelter space is limited, just because it's not necessarily a one size fit all model. Salvation Army, when it opens on November 1st, I believe the capacity of that shelter is 75. I am not sure about the shelter in Port Orchard, how many beds and the capacity they have there. So I can follow up on that one. Yep, that will be coming online.
I think that's right around 80.
80, okay.
Correctly, so
Yep.
80.
Yep, and then there are a
Percent,
few
for
other, entities in our community, places like Eagles Wings, and then we have other kind of transitional housing that provides that capacity. I think Pendleton Place is another example of that, up on Chico Way on the west side, and in a few others. There might be a case where, and there are cases where a shelter might not be able to provide that that medical care, intensive medical care, or behavioral health services that someone might need. And therefore the capacity for individuals who need that type of support is then very limited. And so so it comes this conversation of what can we do for those folks? So they have a place to go, and we don't want them to kind of fall into our criminal justice system or this kind of thing, unless there is a true kind of determined reason for why that would be.
And just to clarify, the 200 plus or minus is countywide, not.
That would be countywide,
Okay.
correct? Yeah, I will kind of lead with a countywide angle, just because that's how public health looks at everything, and then just ask me for specifics for Bremerton.
Thank you.
Yeah. Okay, let's keep moving along here. Alrighty, so
If I may ask a question, how does Kitsap Public Health act with or cooperate with the Bremerton Police Department, specifically the mental health navigator that we have?
Oh, that's a good question. So that's one where in partnership, we would trust that those entities are doing that good work that they know they should be doing. And public health, we don't necessarily, that's not necessarily a role in which we would be coordinating with them closely, unless there is a request for some of our services or something like that, or maybe like technical assistance around an area. Does that help?
Well, sort of. I was just wondering who coordinates the mental health with the Kitsap Health Department and with the navigators, and in order to make sure that people that are currently unhoused and would like to be housed, but they have a mental illness problem. And I was wondering, that person that is the subject that we're talking about, how does that person know who to contact and what to do, other than through the police department?
Yep. And so that would be the situation where if that individual was like was in contact with our Bremerton Police Department, the police department knows exactly who to call to help send in someone or help call on someone who can then come and help that person navigate to where they need to go. And so that's like a kind of role and effort where the public health district wouldn't necessarily be involved because there are dedicated teams to help coordinate that. And so, for example, City of Bremerton has relationships with Kitsap Mental Health Services, right? Kitsap Community Resources, KCR, coordinates and then coordinates with like Bremerton PD and then the other outreach teams that are located in our county. So most recently, for example, I went to an educational opportunity at the sheriff's office, and those sheriffs know exactly who to call when coming into contact with someone who they would know, okay, the best decision right here is to call, the real team to come help support, or call the heart team to help support this person or that kind of thing. So those linkages are very much well in place. And do you see what I mean? So public health doesn't really necessarily have a direct role there. Is that helpful?
Yes, I think so. It doesn't answer my basic question, but it does lend itself to my understanding a little bit of what a person or a person who loves a person who's going through a mental health crisis, what that person can do other than call the police or call 911 and try to get a navigator if they're available.
Yep. And we also have the 211 number. So that's always also available if it's not directly an emergency. For Kitsap County, we also have programs like CK Fire has the CARES team. We have a North CARES team. And so those are other kind of, services where there might not be an emergency and CARES can come in to also help that individual. Yeah.
Thank you.
You're welcome.
I was just going to go back to Robin's question. There is the quality in Kitsap Way.
Yep, that's another one.
So is that a specific type of housing that wouldn't fit under the 200?
The quality in wouldn't necessarily be considered an emergency shelter. So like if there was an extreme weather event, it would necessarily fall under emergency shelter, but it is still considered a shelter. And I think more one of like in the kind of transitional housing space. Yeah. Okay. So I'll just provide some more context here and then we're going to start to get into the numbers. So
Adrienne?
Oh, yes, sorry. Go ahead.
I'm sorry, I put my hand up, but I wanted to say the mental health connections are improving. The last couple of years are extremely different from what 10 years ago was. One of the things the police department has, you can call us and ask specifically for a CIO, and it's a crisis intervention officer.
Yep.
And they are trained and they are really good at getting the person to the next step they need.
Yeah, that's an excellent example, Kathleen. Thank you so much. Any other questions? Okay, fantastic. So just a reminder to us all that homelessness can take many forms. I heard that you all received that article. I think that was in the New York Times. And, I think that article did a really beautiful job of just highlighting how everyone's experience is different of how one might experience homelessness or experience housing instability and really ultimately what ways that can help someone exit that situation if they're willing and able. And I think in the case of the article, it was ultimately this person who had a full-time job, but had debts and other obligations and medical debt and these kind of things, was then able to find housing, but it was that security deposit, right, of like $2,000 of that was the kind of, you know, the last ticket to secure that housing. And I believe it was ultimately the church, I think the article called out, that paid for that deposit. And so it just again goes back to that social ecological model of like where can these various supports come from to help enable someone to grow the resilience and get receive housing. So it's the combination of many factors. We call them like social determinants of health. And these include things like housing, healthcare, livable wages, generational poverty. There's just so many various contributing factors that ultimately impact our health. And we know from the Kitsap County Department of Human Services 2023 preliminary point in time count data that in that point of time, when asked about like the specific cause of homelessness, 113 unsheltered households responded. And we see in this graph here that health issues, mental health was one of those things that rose to the top, in addition to job loss, or maybe there was like someone's experiencing disability and is unable to work, or someone has lost their housing or was evicted, unfortunately. And on the health piece here, I'll point out that Kitsap Public Health Board passed Resolution 2023-1, which is our resolution declaring insufficient access to healthcare and high cost public health crises. Just like cost transparency, you know, it can be incredibly expensive to go receive care, right? Or maybe it's going to take you a long time to even receive that care, and that's something that we're paying very, very close attention to, and are currently undergoing a health system assessment, and those findings will be available December, January. So that's one to keep your eye on, and we'll keep you all informed about those efforts. Here, I want to point out, and I, in preparing for this conversation, I was really wanting to look at this kind of cost of living wages, and then housing. So I have a couple slides to help show this. And so this comes from the National Low Income Housing Coalition, and they specifically look at some HUD measures to ultimately come up with these numbers. And I was shocked because I didn't realize that at minimum wage to afford a 1-bedroom rental home in Washington State, big average, but you have to work somewhere around 77 hours a week to be able to afford that. And that I get goosebumps when I think about that, because that's a lot. It's just a lot. And I think we've seen this trend kind of increase over time. And so again, housing is so important and core to this issue, but we know that with cost of living kind of going up, but our income's not changing as much, that can be incredibly tricky. And in this model, and this is interesting, we might want to verify this looking at some other numbers, but it identified most expensive areas. Bremerton and Silverdale were on there, and that might be because of our being so close to Seattle, King County, and these kind of things. But I was very, very surprised at these numbers. Right. So these things are important to keep in mind. And this is kind of what I was referring to. So if we look at Washington home prices and median incomes, this information comes from the Department of Health. So that red line, so you see home prices in the state are up 212%. That median is like, it's going up. But incomes across the state have only increased 79% at the same time. So that's a big gap, right? So no wonder. So while we have a conversation around supporting folks who might be experiencing homelessness, and that is something that's chronic for them, we also have people that are falling into homelessness, right? Because of it's hard to afford and keep your housing. So how can we make that more accessible?
And that's from what date to what date?
So this is looking at
2001
2001 all the way to 2021. Yeah. I'll keep going here. And then I in researching putting my analyst hat on, I was just like, wow, okay, so what is our shortage? How much more housing might we need? And so coming back to that National Low Income Housing Coalition data, and this was looking at some of our ACS data that comes from our census. We see that in Washington State, we're at a deficit of about 174,821 homes that would be considered extremely low income or designed for an extremely low income renter. And so, yeah, just showing that kind of what the work that we need to do. And a place where this conversation is very much ongoing happening, does Puget Sound Regional Council sound familiar? So that's directly associated with Washington State's Growth Management Act. And they look at increasing affordable housing in what they would like designate as an urban area, for example. And I know that in, so that kind of entity, our Regional Coordinating Council, our local example of that would be our Kitsap, our Kitsap Regional Coordinating Council. And so those are public meetings. I always go to those because I learn a lot, especially in the affordable housing space. I know a lot of local municipalities and the mayors, Paulsbo, Port Orchard, Bremerton, definitely feel the pressure and acknowledge the incredible importance of extremely low to affordable housing needs in our community. And that's another one we're just like needing the funding to do that is just incredibly important. So I know that they're in continuous conversations with our legislators in that regard to help fund those projects. Okay, and then that's all to say that coming back to the Department of Health's research here, and this is the years 2006 to 2022, we see that the number of people experiencing homelessness has risen 16% since 2006, but the share of folks living unsheltered has more than doubled across this time. So do you see kind of that trend of the increased rate of housing, but income's not changing, and these kind of things all kind of coalesce together? And then we know that there's a variety of other kind of individual circumstances that then contribute to that. Let's see. Okay, and then for this section, I'll end on here. So this was brought to my attention. So our Kitsap Public Health Board, Drayton Jackson, pointed this executive order out to me, and I read the full report, and it's fantastic. So this is Governor Inslee led, or I guess executed order 2105, and it's designed to reduce intergenerational poverty in Washington, and it led to the formation of the Poverty Reduction Work Group. And so just know that there's a group working very, very hard around a cost of living, affordability, and closing that gap here in Washington State. And this order was designed to reduce poverty and inequality, because recognizing that it's a dignity, let me say, it's like an act of dignity, humanity, and belonging, that these are basic needs that someone should have, right? We know that for a fact. And so the poverty reduction work group looks at 8 strategies, and you can see, how's that screen looking? Okay, it's not too bad, but priority 5 talks about prioritizing urgent needs of people, especially those who are experiencing homelessness and mental health illnesses or other forms of addiction. Let's see if there's anything else I want to say about that. Okay, so
that executive order was enacted in 20-something.
21, I believe. Yep.
Yeah, that's the 21 at the beginning.
21.
Lets you know what year. Yep.
Yeah, and I can send out and follow up the link to this report. And so I think when community groups, ask me, what can I do in these kind of things? I'm like, oh, there's a plan for that. I'll send you the link, and these plans are formed to, provide these guidance documents of if you want to be more involved in this work, here are those areas, right? Here are those 8 areas where you could be a little bit more involved. And so sometimes those frameworks I find to be really helpful. And it's a 10-year plan.
I can't read it. Could you just quickly just name what those 8 are?
The 8 strategies?
Yeah,
Absolutely.
just really quickly. You don't
Yeah,
have to
thanks for
elaborate
asking.
that.
So the first
I
one
see.
is undoing structural racism. And these are, I think, mainly at that systems level. So how they are manifested in like policy, programs, planning, and other practices. The second is balancing power. So this is that social connectedness of example of how I was talking about shared decision making and making sure we're talking to folks who might be affected by poverty and inequality. The third is increasing economic opportunity. So like that's that workforce component, and targeted equitable income growth and wealth building among people with low incomes. The fourth is ensure foundational well-being. So this is the strength and health supports across someone's lifespan to promote their intergenerational well-being. 5 is prioritizing urgent needs. So this is prioritizing the urgent needs of people experiencing homelessness, mental illness, or addiction. 6, build a holistic continuum of care. I think this is so important. Again, going back to that social connectedness model I brought up. So what does it look like to build an integrated human service continuum of care that addresses the holistic needs of children, adults, and families? 4 is to decriminalize poverty, decriminalizing poverty and reducing I guess the reliance on child welfare, or essentially like our criminal justice system, what are those, diversion programs that we can set up? I think more recently and a little bit related to this issue, City of Paulsbo just stood up their North Kitsap Recovery and Resource Center intended for North Kitsap residents as a way for someone, instead of going to jail, they can go on diversion and then access the treatment center as a part of their, I'm not a lawyer, but as a part of their like case agreement. Yeah, exactly. So that's an example of that. And 8 is prepare for the future of work. So ensure a just transition to the future of work. That one I would have to read a little bit more in detail. Yeah. You're welcome.
So this is just guidelines.
Guidelines.
Are we going to be checking?
Suggested
Is there a way
approaches.
of
Yeah, so I would say the
keeping
report,
track?
this is the 1-pager kind of like fact sheet, if you will. And then on their website, they have the blueprint, and then they do have metrics in there.
Okay.
I think it's an appendix item on like a 100-page document. So I'll send you those links.
That's okay.
Yeah. So thank you for your attention here. And then, so all the data that I kind of just threw at you all, that's all to say that, and I adopted this photo from Thurston County Homeless Crisis Response Plan, and it looks at prevention, unsheltered, emergency shelter, and permanent housing, and kind of like the current system, and then what is the ideal system, right, we want to work towards. So when we look at prevention, right, I was talking about, we want to make sure those willing and able and who want to access homelessness can go on that continuum and do that. And so what does it look like to think a little bit more upstream from that and actually prevent people from falling into homelessness in the first place? So what are the ways that we can keep people housed when they're at risk? And the ideal system looks like keeping people in their current places of residence. And that's not just building more affordable housing, but I could also look at our existing housing stock, right? Making sure it's a healthy home to live in. The landlord's doing all the right things, we can also look to that too. When we look at this unsheltered kind of row here, so people who are in the need of shelter, including car, tent camping, it can take many forms. So that's kind of like our current system, right? We see that in our community, but we want to move to this ideal system where those cases are rare and infrequent, right? Because we've done that prevention work. When we look at emergency shelters, we can look at what are those temporary shelter options. When what are those temporary shelter options and making sure that I think the key word here is there are options, right? Right now, there's not a lot of options in our community. What does it look like to increase those options? And these are incredibly important, especially during inclement weather, cold weather months that we're falling into, or even in our hot days, right? Our smoky days, all those kind of things. And then our ideal system looks like we have fewer unsheltered individuals. And then ultimately we get more folks become housed, and then the reliance on those emergency shelters are, not as strong, but we still have them. And then permanent housing. We want to make sure that there are a variety of housing options and supportive housing options that are low barrier for folks. And so we know that accessing those type of permanent house options are also far and few between. This is, again, kind of goes back to those kind of criterias and requirements that come with things around like housing vouchers and et cetera, but working with a really good case manager. And if we increase those options, hopefully we can have folks who have the increased opportunity to be permanently housed. And so that, I think, lower picture is ultimately that kind of space where our community wants to see, and that's the variety of permanent housing options that exist. And so people can remain housed permanently. And this also includes for our youth too. So any questions on the data that we've seen, the trends happening in Washington State, and then this kind of model of kind of where we are, and then our current system of where we want to head?
Are boarding houses currently under thought or process right now to see that might solve some of the problems or not? I'm talking about room and board, like in It's a Wonderful Life, Christmas, where Christmas movie I love that there's a boarding house there available. I was just wondering, that's an old-fashioned idea. I was just wondering if that was being explored too.
Yeah, it reminds me of like a housing first policy type thing. That I specifically like boarding house thing, I haven't heard that come up in conversation. I think people more so relate to it as like alternative housing options. And that is something that I know the commissioners are hard at work on thinking about, as well as our city mayors and that kind of thing. So I don't have all the information there for you. But I hope that we see an increase of just these additional supportive housing options to come. Is that helpful?
I think maybe we could liken the boarding house to sort of a halfway house in modern terms, where you have
2 meals a day and
you have meals that are available there, and you kind of rent a room.
Yeah.
Similar, not exactly.
Yeah. And I think there are places like this that exist, but we want to increase that capacity, right? And that's what it's all about.
Yeah, I think it's just that we've limited our options of what kind of housing is available. We used to have, like, especially in larger communities, like single room occupancy hotels, SROs, where people could rent a smaller room. It was affordable.
Right.
But then they lived within a neighborhood where they could have all the services that, you would contain within your single family house.
Right.
You could go to restaurants in the deli, have your laundry done, like in that
Absolutely.
community, but we've moved away from that. So it's hard to then find. And then we want to segregate people into their own areas instead of finding housing options within. So integrated, so they're all part of the same community.
Right. Well said. And I will say that that is so important. Being in a good distance to those services that you need and having the transportation to get you there. Currently in our community, that would look like a G2 who provides, they're an nonprofit organization that provides transportation for community members. And I know that they've been hard at work helping our unsheltered community kind of get to where they need to go. And I think most recently, most recently, a lot of those community groups have reached out and proposed budgets to Mayor Wheeler in our Bremerton administration for what does it look like to bolster those efforts, and can we communicate, or can we compensate our community members who are doing that hard work to increase people's transportation to those places that they need to go. And it also could mean that and I'll also say just wanting to emphasize the alternative options, that sometimes a single like hotel room space might not be the best situation for somebody. And so again, just having those, alternative options.
I think possibly too, we have to change the way we think about what housing looks like.
Exactly.
Because for so long, it's been the single family home and it's gotten larger, and space now is becoming, space has always been finite, but the availability of development, land that can be developed is going to decrease. And I was just reading an article this morning that said, houses are, even in the suburbs, are getting smaller because the price tag for building larger homes is unaffordable. Yards are getting smaller, but we're going to have to start thinking that way. If we look at houses from the 1940s, the 3-bedroom, 1-bath house that was maybe, 1,200 square feet,
Right.
we're going to have to change the paradigm.
Right. Yeah. Very well said. Very well said.
So this may be at the end of your presentation, but as someone new to the area, I think you mentioned a number of homeless people are experiencing homeless in the Bremerton area. Has there been any research into who they are? So I see some pretty horrible statistics as it relates to students in the Bremerton High School who are experiencing homelessness. Also, as we were talking about people who are entering that period of life where they're retiring and they're receiving, Social Security benefits, but rents are going up. That's also a potential, or maybe already existing community who are being pushed out of their housing. So I'm just curious if that sort of depth of analysis for this particular Kitsap County has been done.
Yeah, let's get into that. We're headed there next. So
I thought you might be going.
yeah. So I'll chat. So I have this slide and then I have this side. So let's talk a little bit more about that. And I love how this is turned into a discussion. So let's just keep that going. So there's a couple numbers that we look at. And I think for our community, the age range is very wide in who we see or who we might hear stories of as it relates to individuals who are experiencing homelessness. So here's some more data. The public health district, we love data. So going back to the Kitsap County Department of Human Services 2023 point in time count, in that count, 604 people in our county identified themselves as experiencing homelessness. So that in the point of time count is literally that point in time. I don't know if anyone's ever volunteered for doing that work. I'm not sure if that's still open, but I think there is one that's upcoming, and it might remain open if you're interested. I can send you that link. And so in that point of time, and then 58% of participants experiencing unsheltered homelessness were in the city of Bremerton in that point in time. So Bremerton very much so has the kind of predominant presence of individuals as far as that point in time count. And then something that we also look at, and I think it tells a much larger story, because me, I like big systems thinking, is the Washington State Department of Commerce. And so they have a dashboard, and according to that dashboard, in Kitsap County, we have 2,358 individuals who have entered supportive services in our county. So I think that tells a much bigger story, and I think puts emphasis on how having those coordinated hubs of care, those continuums of care, having an individual who you can rely on, like as a case manager, who can really help you navigate your way through, is so important, because we know a lot of people lean and look to those services. And so these are things like accessing emergency shelters, transitional housing, programs just around like basic human needs, and then things around like rapid rehousing. So Washington State Department of Commerce tracks that information. The point in time count is a statewide initiative, and that information also goes into this database. I'll also mention in the point in time count, an individual has to give like a verbal consent or sign for their information to be shared. So that's actually a database that I personally don't have access to. So some of the nitty gritty questions around, I had them all printed out, but yeah, the kind of specifics of people who are living on MLK and Broadway, for example, I'm not privy to, but that is information that Kitsap County Department of Human Services collects and keeps track of. So they have a lot of that information. But I can tell you from my own personal interactions and my own kind of community volunteering, there are young people, there are young adults, folks, 20s to their 40s, and we also see older individuals, folks who have disabilities. We also might encounter folks who this could be like their first day or second day, or have been homeless for a long period of time because they have actually maybe chosen that. So this is all to say there's an array of individuals and experiences, and that is something that the HEART team, that's information that they collect and keep track of. I was going to say one more thing on that. Let me think. Oh yeah. And then there is also a question of, I think how many people are homeless at any given time in Bremerton and Kitsap County. Those are also numbers that, like that real-time data, I don't necessarily have, but again, the HEART team is the entity that keeps track of that. And so I guess I don't know, if you have additional information, you could reach out to them in regards to that. It's just personal information I'm not privy to. Okay. Now, the information I do have is that looking at the demographics and social determinants of health in our county, and a lot of this is included in those data packets I gave you. One thing that I wanted to point out here, so I earlier talked about cost of living, rent burden, that kind of thing. So we know that 52%, so that's about half of Kitsap residents, or Kitsap renters, spend more than 30% of their monthly income on housing, and that is a data point from 2021. So I assume that that trend is, I really want that to decrease, but from the data that we saw before, it could be about the same, if not more. And then we kind of look at Kitsap County compared to the state data I was showing you. So Washington State across the board, Washington renters spend more, or 49% of Washington renters spend more than 30% of their monthly income on housing. So that just shows us in comparison to the state, we're a little bit higher than that. Let's see. And then, okay, I'm just gonna keep going. So now I'm gonna kind of get into the strategies, more strategy. Let's put our heads together. How can we kind of tackle this? So just to kind of point out a lot of things here, we have multifaceted challenges in our community, and challenges more so when we think about our social ecological model on that community and systems level, which we know impacts the organizational and the individual. So we talked a lot about limited affordable housing options for low-income families in the face of rising costs. We talked about limited shelter availability and the high barriers that might come with someone being able to access a shelter. It could also be the case that an individual, because of risky behavior, or because their behavioral health needs are unmet, may not be allowed into a shelter. And then we can ask ourselves, well, if they can't access the emergency shelter, and we have an unauthorized camping ordinance that says that you can't camp here, and would then give permission, if it would result in that, to arrest somebody, what's the middle ground? Where can someone go? There has to be a better option, right? And that's where, again, the social connectedness, the coordinated care, and those intensive services are so important. That leads me to talk about insufficient access of healthcare services and high costs. So there might be someone who wants to seek treatment or go through medical detox. We don't have a medical detox center close in our community. And so often the teams that help provide that individual support end up driving people long ways to have them be medically treated and assisted with their various needs. So that's something that we need in our community. Transportation, we talked about that. And sorry, that's a typo. There should be an S on that. Transportation options. And as well as a recovering workforce. So we want to make sure that we have the community capacity and people are well resourced, and that our case managers are well resourced to do this work. What we don't want is a situation where an individual wants to go, they might want to be housed, they might want to go seek treatment, but their case manager left their position, or there was just some kind of like shortfall there, and then that person's kind of left hanging, right? We need that robust social ecological model to be well coordinated. And then funding and administrative limitations. Most recently, I think an example of that is during the last City of Bremerton study session. I mentioned how community groups have submitted a budget right to the mayor of, this is what we would need to continue our services. Will you support us in this work? And you saw the council members put their heads together of, we don't necessarily do that. That's out of our normal process. We normally do like an RFP, these kind of things. So how, there's administrative limitations to trying to provide those emergency, like that emergency response for those, resources to help with the immediate need. And so sometimes when it comes to immediate needs, working through government processes, they don't always, align because of some of the more bureaucratic type procedural things that an agency might have to go through. Let me say a little bit more on this slide. So I reached out to a friend who is in the community and who is highly involved in supporting folks living on MLK and Broadway. And so I asked them to share a few talking points. And so this is information given to me to provide to you all. So another, this is for the next slide. So then let's talk about how do we turn that curve, right? How do we make that better? So this individual shared with me stable, consistent funding for field-based intensive case management available on a daily basis, right? So they told me that this is often referred to as assertive outreach. So because someone is always there, right? They're always with you. And this has a wealth of data to support its effectiveness in linking people to services such as housing and recovery support. And they pointed out that in Kitsap, we do have some really great programs in the county, but we're missing that hub model. Does anyone remember the program Kitsap Connect when that was around?
I know the name.
Does it ring a bell?
I think you're on a different slide.
Oh, no, I'm on the right slide.
Oh,
yeah, no worries.
Okay.
And so Kitsap Connect provided that type of hub model. It's that program sunsetted and is now reflected in Peninsula Community Health Services Stand By Me program. But it was a fantastic program. And after this conversation, I'll send you the public health districts supported that program years ago, and we have a video, and I think it's still good. I watched it the other day, and it reminded me of that. Yes, that hub is so important. And this hub and spoke model is so important to first build rapport and trust with individuals, that's social connectedness, help link people to basic needs so that they have the cognitive space to address their higher needs. So that's like healthcare, mental health, recovery services. So on this slide, I'm kind of speaking to the outreach-based care, such as programs like Kitsap Connect. And then we know that that can increase, civic engagement, belongingness, and social connectedness because we've done that intensive outreach, trauma-informed care, and relationship building. And that all has led, right, to maybe that person seeking those integrated behavioral health services that they might need. And we know that that is something that is also limited in our community. Another thing that they point out is that it is so important to be easily and consistently available when an individual is ready for change to link to other services, such as the real team. So in response to the earlier question of like, how does someone know who they can go to? The idea is someone is there before you even think to ask. What does that type of model look like? The real team is a 24-hour program. There's someone always on call, or there's someone always present, right? For someone to lean on. And I will say that Kitsap Connect is really, I think, such a model that our community, we know that works in our community. And I would even ponder, with my community hat on, what is that? What would it look like to bring that back? It was very successful in getting high utilizers of, jail, 911, and hospitals into housing, treatment, and medical and behavioral health care. It was multi-agency, holistic, involved holistic case management with integrated services from Kitsap Community Resources, Peninsula Community Health Services, and Salvation Army. And all those folks are remaining in conversation today and probably as we speak. Another thing that we pointed out and talked a lot about in conversation was around transportation. And we need funding for transportation. Gas isn't cheap. And transportation is really important, again, because we don't have, to kind of increase someone's ability, I would say, to access treatment beds, detox and that kind of thing. Our nearest medical detox is in Tacoma, and that facility doesn't allow smoking, right? So someone might enter detox, might have to wait, and do you know what I mean? So when we talk about access to low barrier places, a sense of belonging, it's sometimes like we can't just expect that people are going to show up, and then these other things that they might want to do are not allowed. So that these are things that we can think through. The nearest medical detox that allows smoking and medical detox is in Longview. And I bring up the smoking part is an example how someone it's kind of like a fault line, right? So if our facility says, you can't smoke here, and that person wants to leave, we want to make sure that they feel welcome and have a sense of welcome and belonging to stay there, right? If they leave, it might interrupt that person's, when they first kind of worked up the braveness to say, I want to go seek this care. And so we want to make sure that that is an environment where they feel like they can stay and are allowed to do some of those things, just like in the interim, right? So so they can ultimately kind of continue this care. Other things I will add is let's talk a little bit about like drug use. So fentanyl, for example, opioids, is present in our community, and detox from fentanyl is incredibly hard. It is like incredibly intensive on the body to go through medical detox. I'm not a nurse practitioner or a doctor, but those are the facts. And so how can we make sure that someone can be successful in their medically assisted withdrawal and management, and make sure we have facilities in our community, right, to be able to do that? That would be huge. We talked a lot about affordable housing, and that's also incredibly important. And what does it look like to have, extremely low to affordable housing be readily available, actionable, and like coordinated? So those are some of the things that they told to me, and I hope that's helpful. So that's my last slide there around housing first approaches with reliable and comprehensive support to services, and again, meeting that income barrier. Any questions on some of the wide range of kind of solutions from a public health perspective that I just named? Any questions? We want to talk about any of those?
All of that information in the text
The detox, yeah.
Enlightening.
Mhm.
I am sorry, I was writing, so maybe I missed it. And you mentioned one day use center in Bremerton. Did your colleagues?
Oh, yeah, I can talk about that. Yeah, so the Day Use Center is located in Paulsbo.
Okay.
It opens October 26th. And it's kind of in its design concept, it is thought of a place where I'm gonna throw some laws out there. So the Lake fix might sound familiar, but it's essentially someone could be arrested for, you know, the open kind of public use of substances that yeah, so like something like an opioid or fentanyl, or like you're smoking fentanyl, or what have you. So a police officer could arrest you if you're using that publicly. So the idea was that with the Paulsbo Recovery Resource Center is instead of someone being arrested and going to jail for that, they could have an option for diversion and where they would go access a treatment program. So Paulsbo Recovery Resource Center is open, or will be, because it opens October 26th, 1 day a week, and there's also appointments available. It provides options for someone to become a member of that center to increase belonging, and then receive peer navigation support. And there's also they have medical partnerships to support someone to then help them and kind of prevent someone from going into our criminal justice system.
So they don't actually go there to stay, they just go there to get.
They would go there to
Directed.
receive treatment and then be connected with peer navigators and coordinated care and other
where is-
services.
It's in Paulsbo?
It's in Paulsbo. The location in Paulsbo? It is above the Martial Arts Center. It's next to where AA has their meeting. So it's on the street. If you go, it's on 8th Street, kind of up from Front Street behind Viking in the center there. I don't have I actually probably don't even pull up the direct address. I think I could. Okay.
And it's only 1 day per week.
1 day per week with the opportunity for appointments. They're just getting started and have some funding under their feet. So that's one that we hope can be scaled up over time.
Like modeled, and then other communities could have their
Yeah.
own local place to go to.
Is that a nonprofit or is it run by the health?
Oh, that's a really good question. So it's an initiative of the city of Paulsbo, but I don't know if it's currently on funded by a grant, I believe from OCH. I believe so. And then, but I don't know if it's considered its own entity or still a part of the city of Paulsbo. Kim Hendrickson, who is with the Department of Human Services in Paulsbo, is the perfect person to ask these questions to. Rebecca is the director coordinator. Yeah, that's as much as I know. And it's the facility is designed to support folks experiencing or folks who want to start recovery around like alcohol use or other substances. And then they also have a partnership with Kitsap Mental Health Services and that kind of thing. Yeah. Any other questions on the to-dos? Okay, and all this to say is incredibly important because we know that there are community environmental health concerns related to lack of housing, lack of healthy housing, and like housing instability, and also living unsheltered. And so examples of that include lack of access to clean water, bathroom facilities, and sanitation. For those who might have been tracking public testimony the past couple months at the city of Bremerton, you might have heard a lot about community advocates saying, we need porta potties, we need sanitation centers or stations, and these other type of supports to the city, and that kind of thing. Exposure to weather-related hazards, extreme heat, I'm so sorry. Cold, import air quality. I'll clean these up before I give them back to you. Extreme health, oh my goodness. I don't know what that means. Extreme heat, apologies, cold, import air quality. example, this past summer, I believe Salvation Army did open its doors during the wildfire smoke and extreme heat. So that was something that was organized effectively. And also another role where the public health district can play as we start as within our emergency preparedness team, trying to coordinate those services. The another thing is around like respiratory illness. COVID is the ultimate example of that. Heart disease and other kind of chronic medical needs that might not get met or remain untreated. Mental well-being and behavioral health risks. You might remember that wheel I showed you earlier around feelings around being overwhelmed or past trauma, and those kind of things. We see increased mortality, particularly around youth and young adults. And that is compared to our house population, it's 10-fold higher, your likeliness. And then the physical health consequences of poor health or insufficient connection, that's that social connectedness piece, can actually result in 29% increased risk of heart disease, 32% increased risk of stroke, and 50% increased risk of developing dementia for older adults. And so again, that social connectedness piece is so important. Oh, that reminds me, for older adults, the term that we talk about is around like aging in place. And so what does it look like to support someone to age in place so they don't necessarily have to move? They can remain connected to their social circles, their family supports, you know, their medical people, that kind of thing. We want to make sure that that person can age in place, in a healthy place. And again, on the point of social connection, there's research out there that shows that it can increase risks of premature death by more than 60%. So again, that social connectedness piece is so critical. Any comments or questions on the community and environmental health concerns? Okay. So let's talk a little bit more about the role of public health. And again, we're in the process of really looking at what other things can we do to support our community. This is an emerging conversation also at the Department of Health, which is really exciting because again, remember, traditionally public health looks to human services and our human services departments to help lead and coordinate these type of responses. But what does it look like to bolster the role of public health in the conversation, right? I think in the pandemic, we all realized that many of us have to wear multiple hats. And what does it look like to have, again, that more integrated model? And then, yeah, so here are some of the things that I thought of. And again, here are our guiding principles. So prevention, how can we prevent this in the first place? Collaboration, work amongst our agencies, lead with equity, innovation, and quality. So this could look like and has looked like in our community responding to environmental and health concerns for both solid and hazardous waste, as well as sewage disposal issues. And so at Public Health, we have a solid and hazardous waste team, and they do things related to solid and hazardous waste. Public Health can also provide resources for overdose prevention and intervention through access to naloxone supplies, training, and referrals. So this would be something a little bit more downstream, or what you could call them like pre-positioned resources. Is everyone familiar with naloxone and what that is? Okay, fantastic. I think I even have, my naloxone kit right here. And so if you're ever interested in receiving a naloxone kit or training, that is something else that Public Health District does. If you're interested in learning more or want to go through your own training. So naloxone is so if you are walking down the street or you happen to, be in the vicinity of someone and they're overdosing, naloxone is just kind of like the nose sprayer. And with naloxone, you can potentially save someone's life because it reverses sorry, again, this is my medical failing me, but it reverses the things like chemical responses that would lead to an overdose. It reverses that.
But it's opioids only, right? So,
for an opioid overdose. Yeah, thank you. So if you have interest in that. And then we collaborate, convene partners to strengthen relationships. That is so important. And sometimes that is my favorite role of public health, is just kind of getting all the entities together and being that convening body who can do that work to keep the conversations going, keep the innovation going, keep people inspired to make our community a very healthy place. And then we can, by request, provide support for shelters, respite facilities, and other centers. In the pandemic, this looked like guidelines, safe distancing, these kind of things. It could also be for programs around our related to communicable diseases, making sure everyone is well and healthy, and providing maybe those screenings for folks, things like that. Ongoing data and assessment. You've seen how core that is to our work, and you have that packet in front of you. And then policy development. So one thing in the world of public health, we call it like a health and all policies approach. And I'm in my current work, and I'm looking to bolster, what does it look like to have a health and all policies framework available for our decision makers, our community, to help to essentially increase the presence of, when we're thinking about a policy, how might it change, or what might we do differently when we're thinking about centering someone's health in that policy, even if it's an ordinance. I do think it's possible. Technically, things like an ordinance tell us what we can't do, but how is it working, or what went into the consideration of that policy around health and well-being, mental wellness, physical wellness, and that kind of thing. So that is something that is always on my to-do list. Any questions around the role of public health?
So we usually end at noon, but
Okay. I'm right
are
at the
you
end
okay?
of my. Okay.
Yeah.
Okay, cool. So I'm right at the end. So just want to give a high overview of what's happening in our community. So since this summer and coming into the fall, we talked about the ordinance. As a follow-up to that ordinance was what is the implementation response plan, and the Mayor Wheeler presented that in the last study session. And again, that's a really good place to stay up to date with that. So right now it looks like I think it's going to come down to budget and the budget conversations within the city.
So, and I will interject that I get the agendas for the study session, and this Wednesday, they are discussing the Oyster Bay land as part of their study session.
Yep, so that would be a good one to tune on into, and you can you can do that virtually as well.
Sorry, when's that?
This coming Wednesday.
Yep. This looks like the ongoing.
I think it's 5 o'clock, isn't it?
Yes.
Or 5:30.
I think it is 5 o'clock. 5 o'clock or 5:30. I don't think they meet before then. The ongoing community organizing. So I talked a lot about the community organizers who are on the ground providing those intensive case management services. And then I know that Kitsap County Board of Commissioners is thinking long and hard about increasing alternative low barrier housing options. And again, the affordable housing piece is happening in that regional council I mentioned. And there are many, many more ideas in progress. And I truly hope the funding comes in to bring them all to fruition. So staying informed, we talked about ways to stay engaged with city and council board meetings, committee meetings, public meetings, those kind of things, those study sessions for those updates, as well as keeping an eye out for things that might come out in our media, like the Kitsap Sun. And you can always have the opportunity to reach out to your local representatives. That is all I have for you today. Here are a list of my references. And then here's my contact information. And then for you all, I made a personal phone call to Doug Washburn, and I asked him, can I put all your information on my end slide if the group wants to reach out to you? And he said, absolutely. So there is his email and contact for you all as well. Did I cover a lot of ground? Thank you so much. And again, thank you all so much for your attention to this. I just think it's incredibly important as a community that we come together. I've lived in New York City, Washington, D.C., and now Kitsap is my home. And I am very optimistic that we still have opportunity to put in those equitable safeguards to turn the curve on this issue in our community. And I think the more we remain innovative and vigilant, and as community members share our voice, that it will remain a possibility. So thank you all so much.